My dad was in the military for 28 years, so we moved from house to house and school to school quite often. But it allotted us the chance to meet a lot of new people. So as I finished dental school and I got into treating patients while I was in the Navy, I was in the Navy for 4 years, I started being able to treat different patients that had different levels of oral care, different levels of anxiety, just came from all different backgrounds. And I could appreciate the uniqueness of this. It started to change from liking dentistry to actually liking to see transformations in the patient. So there's nothing more rewarding for me to be able to see a patient that comes in with a deep level of anxiety that's deeply seated, something from a childhood, and then take them to a point where they're comfortable enough to come and sit in the chair without that anxiety. There's nothing more rewarding. Part of what I love about our practice here, we have such a high hygiene retention. It's about effort and time that you give to the patient when you're with them that they can feel. So how has that area been feeling on the right side? And when they feel that care from you, I think that's what makes the difference. I think that's what makes them want to come back. And actually, last Friday, almost all the patients were patients that I had been seeing for 3, 4, 5 years. And I feel like I've formed personal relationships with each of them where I come in the room and instead of just being like the dentist, you know, I'm a friend. And I try to form that each time I see a patient so that we have something to talk about, and it's natural, it's not fabricated. I saw an emergency patient yesterday, it was on a Sunday, and she apologized. She said, "Oh, I'm so sorry that you had to come in." And I told her, "No, you know, I'm here for you. That's why I live in the town where I practice." I think that's part of being like a complete care facility, provide them with that extra level of care that makes them feel like they're important and not just another number. As a healthcare provider, I believe that overall health is important. I've been active for a long time, but I've been more active since I became a dentist. I started to kind of see the importance of keeping your whole body healthy, and so I started running, got into some weight training, and that's where I got into CrossFit. You demand excellence of yourself in your work in the gym, and you demand excellence of yourself here, you know, when you're working on patients. I think so many times people get stuck in a rut in their jobs, and I can truly say that I love doing what I do. And I think that a lot of that comes from just enjoying the people you're around. That includes the staff and also the patients. That makes it so much better. But then just enjoying what you do and feeling good about what you do.